it is an honor to stand before you tonight. I hope you can tell that I'm really excited and eager to have this opportunity to lead the nation's largest and most influential physician organization as your president. Now is the time when we as physicians have an unprecedented opportunity to shape the future not only of our profession, but for our patients and all of healthcare for years to come. I want to begin tonight by recognizing a few special people. First of all, I want to thank Dr. Gurman and Dr. Stack. It has been a marvelous association with them in their leadership roles, for their mentoring, for their friendship, for their leadership. And that appreciation extends to the board members as well. I think you will admit that we have the strongest and most diverse board that I can recall, and it's the kind of board that our AMA needs to capture the perspectives of our profession and address the challenges that we face. I would also like to thank the AAFP leadership and their AMA delegation and all the family physician delegates and alternates in the House for their support and encouragement and their advocacy on my behalf over the many years. Next, my most sincere appreciation to the Missouri State Medical Association, their delegation, and their staff. You know, as with many of you, if it were not for their willingness to not only encourage me, but to support me beginning over 20 years ago when they first sent me to this House as an alternate delegate, I literally would not be standing in front of you here today. I also cannot adequately express my appreciation for the Mercy leadership, who've made it possible for me to have time away from my practice and their leadership responsibilities to serve our profession. Their presence here tonight is evidence of that support. Mercy leadership is among the most visionary in our industry, and from them I've learned and acquired knowledge and skills and expertise that have helped make me a better leader, but have also enhanced my contributions to the discussions here at the AMA. Mercy is a leader in the area of telehealth and virtual care, and it's a little bit ironic that through the magic of the EHR and WebExes, I remain in nearly constant contact with both my patients as well as the leadership team at Mercy, whether I'm here in Chicago or in Washington, D.C., or the World Medical Association in Africa. Often they don't know if I'm in Mountain Grove or 1,000 miles away. In fact, I've kind of started referring to myself as the virtual Dr. Barbe. So Lynn, Mike, Fred, Alan, Stuart, Janine, thank you so very much for allowing me to do this. My clinic manager, Lois Flagel, is here tonight with her husband, Ron. And unless it's your spouse, how many of you have the same clinic manager that you started practice with? I do. Lois started with me the very first day that I opened my solo practice in Mountain Grove 34 years ago, and she's been my clinic manager throughout that entire time. So I want to thank her for making our practice so very successful and satisfying. Now I need to recognize my family here tonight. I have to begin, of course, with my wife, Debbie. We played kick the can together when we were very young children and lived only a short block apart in Mountain Grove. We became high school sweethearts when we played George and Emily in the high school production of Our Town. Debbie raised our two children, worked by my side in our clinical practice, and always keeps the home fires burning. We celebrated 41 years of marriage just a short month ago, and I could not have imagined or asked for a better partner, wife, and friend. Thank you, Debbie. Love you. Also here tonight is my daughter, Adele McAllister, and her husband, Matt, and their two sons, Kaylin and Connor. And my son, Nathaniel, who I am very proud to say is the newest Dr. Barbe, having graduated last month. From the Kentucky College of Osteopathic Medicine, his wife Cheryl, and their 4 children, if you can imagine going through medical school and residency with 4 children, Ava, Micah, Claire, and Samuel. My brother Mike and his wife Suzanne are here tonight, and my nearest older relative, my uncle, Al Breitenbach. Inaugural speeches are intended to inspire the audience, rally the troops, and lay out the President's priorities for the coming year. I intend to do that, but in a little different way than you might expect. In spite of the size, this is actually a fairly intimate group in this room tonight. most of us actually know each other fairly well. So my remarks tonight are going to be a little bit more personal, a little bit about us, and about our roles and responsibilities as we wrap up the HOD tomorrow and return to our day jobs. Earlier this spring, the AMA released results of a physician survey that affirm my own view of my choice of medicine as a career. Half of the physicians believe their choice of medicine was not just a job, but a calling. 3 out of 4 of us are primarily motivated by the opportunity to make a difference in the lives of our patients. And nearly 3 out of 4 of us knew we wanted to be physicians before we were out of our teens. For me, that calling did come a little bit later. I didn't feel the specific calling to be a physician until I was early in college. When I finished high school, like many of you, I knew I wanted to help people. I knew I wanted to make a difference. But I thought I would do this by becoming a math teacher. I was really turned on by helping other students understand math and science. But after a year or two at the University of Missouri, it dawned on me how much of being a physician was essentially being a teacher, teaching people about their own health, and that maybe medicine, at least for me, would be the highest and best calling and the way to fulfill my desire to make a difference in people's lives in a very direct way. So I changed my major from math to microbiology and set my sights on becoming a family physician. Our hometown of Mountain Grove is a low-income, underserved area. The population, less than 5,000. The median household income, 28,000. That's compared to a statewide average in Missouri of 50,000, which is even less than the national average. Many people are unemployed, uninsured, and in many other ways fall through the cracks in society. Debbie and I saw our return to Mountain Grove as a mission that appealed to our desire to serve and to make a difference in the lives of our patients and our community. And it is still our mission, 34 years later, to serve our neighbors and our friends. My practice continues to be immensely rewarding and really very satisfying. Hardly a week goes by that I don't get a card or a comment from a patient or one of their family members thanking me for helping them get the care they need. But every day, I also see patients who need tests or treatments, who are still uninsured or haven't met their deductibles, and due to this, they often delay necessary care. Because of these patients, I see firsthand every day why the AMA's unwavering goal of affordable health insurance coverage for all is worth fighting for. Keeping this issue front and center is critical as we debate health system reform again and again and again. Just a couple of weeks ago, I had the honor of delivering the commencement address at the Kentucky College of Osteopathic Medicine, and as I mentioned earlier, that event was especially meaningful for me because my son Nathaniel was presented with his Doctor of Osteopathic Medicine degree at that ceremony. It just so happens that his dean was Dr. Boyd Boozer, president of the American Osteopathic Association, who's with us on stage this evening. So recognizing that those young men and women are our future colleagues and the physicians to whom we will one day leave this profession, I tried to impart some words of wisdom about leadership. Words that I hope that they wouldn't forget 5 minutes after I finished speaking. I told them that whether or not they thought of themselves as leaders, simply by virtue of being a physician, they are leaders. Patients will look to them to lead their care. Other members of the healthcare team will look to them for leadership, and our profession needs them to be involved and to lead. So I gave them a challenge in the form of a question. I said to them, "You are a leader. What kind of leader will you be?" I think that question applies to every medical student, resident, and physician in this room tonight. What kind of leaders will we be? I recognize that every physician here is already a leader at some level. Sitting behind me are state medical society presidents, AMA past presidents, AAFP and AOA presidents, and our board. And there are many past, and I hope future, state and specialty society presidents in the audience tonight. But being accomplished in our field or holding a formal leadership position within our organization does not automatically make us good leaders. We must continually ask ourselves, what kind of leaders will we be? I submit to you that physician leadership is less about a title or a position and more about being a positive influence in whatever setting we find ourselves. Leadership is modeling behaviors that we need from others, working cooperatively, developing solutions by consensus, improving care by drawing on the unique skills of all members of the healthcare team, and demonstrating integrity and respect in our interactions with others. There are 3 areas where physician leadership is absolutely critical right now: in advocating for health reform in today's political environment, in describing and shaping the future of healthcare, and in mentoring those who will one day follow us in this profession. About 10 years ago, the AMA launched a campaign to raise awareness about the 50 million Americans who are uninsured and to develop solutions to expand coverage. We worked with both parties in Congress on the Voice of the Uninsured campaign. Both political parties were very open to our policy suggestions, and in fact, many of our policy proposals were showing up in recommendations from think tanks and in legislation on both sides of the aisle. Everyone understood the costs involved in expanding coverage to tens of millions of Americans who were uninsured. But just a couple of years later, in the wake of the 2008 election, the debate over the Affordable Care Act became very partisan. Many consensus opinions that had bipartisan support were being abandoned, not because they were wrong, but because the wrong party proposed them. We are seeing a similar scenario unfolding now in the health reform debate. There are some factions in Washington that both then and now are saying not only no, but hell no to working together on even some of the most basic principles of access, availability, and affordability. I submit to you that that might be good theater, but it is not good policy, it is not good politics, and it is definitely not good leadership. Good leadership is constructive, it is consensus building, and it is principled. Yet good leadership lays down few absolutes. Let me give you an AMA example that is near and dear to those here in the room tonight. No one who has gained insurance under the Affordable Care Act should lose it. But this, thank you. But this principle from our health reform objectives is flexible and it is practical. We are willing to consider options for better, more cost-effective ways to cover the uninsured than we are doing now. But our measure of any policy change should be this: does it represent progress? Is it an improvement? And we must oppose efforts to weaken the healthcare system or cause our patients harm. And we must always be open to alternative approaches that may achieve our goals. We cannot allow ourselves or our debate to be corrupted or co-opted by the hyper-partisan political climate. We as physicians and as a profession are better than that. And as physician leaders, we bear greater responsibility within our profession and our society. We must continue to put our patients before politics. Physicians are trained and experienced in difficult conversations. Let's put that expertise to work. Our role in today's advocacy climate means de-escalating the highly partisan rhetoric. It means working with all stakeholders on issues that are simply too big to be left to the parochial interest of one party or the other. When it comes to healthcare advocacy, we are the leaders. What kind of leaders will we be? Beyond reform, physician leadership is critical in describing and shaping the future of healthcare. The AMA, hands down, is the organization in the best position to understand the problems that patients and physicians face and to help develop solutions to improve quality and delivery of healthcare in America. On Saturday, Dr. Madera told us about the recent successes in the AMA's strategic arcs of endeavor. It's a new way of describing the many ways that the AMA is shaping healthcare, but the mission and the purpose remain the same. The AMA is leading the way by listening to, supporting, and empowering physicians and medical students in their quest to provide the best patient care. The AMA is leading the way as a representative of all physicians through our House of Delegates as we work together to bring to life the ambitious AMA mission to improve the health of our nation. And of critical importance, the AMA is leading the way by serving all physicians through our 3 interconnected strategic arcs, which demonstrate our commitment to helping physicians grow professionally, solving physician workflow needs, and improving the practice environment. I'm passionate about all of this work because it will allow us to be better prepared, have better tools, and give better patient care. Taken together, this is the way we will restore the joy to the practice of medicine. So when it comes to shaping the future of our profession, we are the leaders. What kind of leaders will we be? And finally, physician leadership means encouraging and mentoring those who will follow us. We must ensure that others are ready to take our place. Tom Peters, the author of several books about business management, puts it this way: leaders don't create followers, they create more leaders. We must encourage and mentor students, residents, and our younger colleagues, and be an example of leadership for them so that they in turn become the leaders that their patients, their practices and hospitals, and our profession so desperately needs. I've had the opportunity to speak to several student and resident groups recently, and I always encourage them to join all of their relevant professional societies, county, state, specialty, and of course the AMA. Why? There are many reasons, of course, but in the context of tonight's remarks, physicians need to support one another now more than ever before. Our medical societies provide a network of professional support that is one very important ingredient in the antidote to burnout. We lift one another up during times of difficulty, and we should encourage one another to be our best. When it comes to encouraging and mentoring others in our profession, we are the leaders. What kind of leaders will we be? Every day, I marvel at what a gift it is to do what we have the privilege of doing as physicians. I feel intense gratitude to have had the opportunities I have had to help patients, families, and my profession. I am eager to serve you and our profession this coming year and to continue the great work that we're doing together. So I'm going to close by posing this question one last time. As physicians, we are leaders. What kind of leaders will we be? Tonight, I challenge each of you, and I rededicate myself to be the leaders that our patients, our practices, and our profession needs us to be. Let us be the leaders who bring consensus solutions to difficult issues. Let us be the leaders with the creativity and the drive to shape the future of our profession. Let us be the leaders who mentor our next generation of physicians. And let us be the leaders that John Quincy Adams envisioned when he said, "If your actions inspire others to dream more, learn more, do more, and become more, you are a leader." Thank you very much.